Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then now clinical features of epiphrenic diverticula. A patient with epiphrenic diverticula, in most of the cases, he is asymptomatic. Most of the patients or majority of the patients are asymptomatic, except that there are few patients which can develop with chest pain, and dysphagia might be seen in few patients, but this chest pain and dysphagia will indicate that there is a motility disturbance which is going on in the patient. So it is most common in most of the conditions. It is found out incidentally mainly. Then if you see the diagnosis, in the diagnosis of epiphrenic diverticula, in the diagnosis, investigation of choice for epiphrenic diverticula is the barium swallow, which we use. Lateral views are mainly used to determine the size or side of the diverticula, whether it is right side or left side. We can also do a manometry is also done to identify the primary motility disorders. Then treatment of epiphrenic diverticula. Epiphrenic diverticula is mainly treated by a surgery where we can do epiglotopexy can be done to the patient. Then if the patient has either chest pain or dysphagia, or if the patient has any documented motor abnormality, in such cases long esophagomyotomy can be done to the patient. So this is about the epiphrenic diverticula clinical features. We have seen the diagnosis and also the treatment of epiphrenic diverticula.
thank you and thank you for watching.